patient who presents to us to the hospital with a left-sided weakness, slurred speech, and gets a CT scan. But the CT scan does not show much. I will show you the CT scan for your um, just for your baseline,
Okay.
and then because on the CT scan nothing much was visible and the clinical history was strong, they referred straight this to the MRI. So I am going to show you both the CT and the MR uh, for your comparison purposes. So here is the MR. I'm giving you the flare sequence. Do you want me to magnify the MR or do you want me to keep it going like this?
Can you please magnify it a little?
Yes, I can. No problem. Here you go. So I'm coming from the vertex down.
Okay, I'm presented with axial flare MRI of the brain. There are a few scattered white matter hyperintense foci in subcortical and preventricular areas. Um,
Yeah, keep
I'm
going,
going
keep speaking.
to okay. Um,
And
can
coming
you
up.
go back up again? Yeah, please. The cerebellum looks fine. Okay, can we go down a little bit again, please? The left, okay, more down. I'm suspecting like slightly hyperintense left transverse sinus, but I would like to see it on T2 to ascertain the flow void is preserved or not. And there is such.
Okay, I will show you the T2 as you asked for. Yes.
Okay, going back on.
Yeah, keep
I think,
speaking.
yeah, the flow void of the left transverse sinus is lost, I think. And but other dural sinuses seem okay. Um,
Yeah. Do you want to see a um,
can I see the T1?
T1 in our stroke protocol because there was a
Okay.
history of stroke? We don't do a T1.
Can I see diffusion and ADC?
I
DWI.
can. So before we go to diffusion, what do you think so far?
Well, I'm concerned about venous sinus thrombosis. On
Okay.
flare, can we go down to the pons more? Okay, on flare, I suspected a hyperintense signal at the right hemipons, but it doesn't seem to be the. Oh, there. Yeah, at the right
Okay.
hemipons. It might be like old ischemic insult. I would ascertain from the DWI as well,
Mm-hmm.
if it is restricting or not. No associated mass effect. Other
Okay.
flow voids seem to be major flow voids seem to be preserved.
Mm-hmm.
Um,
So can you? So for the audience, she thinks there is something in the venous sinus. She's not sure, but she is comfortable enough that there is nothing in the venous sinus. Then she is worried a bit about the pontine, but she is not very concerned. Um and in a stroke type situation, she thinks all the vessels are unremarkable. Am I correct? Have I summed you up appropriately?
yes.
Okay. So then she is looking at what are you interested in now? What
DWI.
sequence? Uh, DWI. So here is your vertex. This
Okay.
is your DWI.
So far. No restricted diffusion. Okay, there's, I think, um, well, there's some hyperintensity at the right hemicones. In my routine practice, I would check the ADC to make sure it is not T to shine through, but I think it is restricted diffusion. Okay.
Not much. Okay.
Mhm.
Maybe, maybe not.
Yeah.
Nothing very obvious.
Yes.
Okay.
No corresponding ADC hypointensity.
Yeah.
Okay. No other areas of restricted diffusion. And
So what is the thing that is missing in your description, in your observation? What is it? You looked at the vena. Okay, so let me sum it up for you.
okay.
So you did look at the white matter hyperintensities. You looked at the venous sinuses, but you, even on the T2 weighted sequence, you can see vessels being abnormal. Remember, the vessels have got flowing blood, they have got flow void. So if you look at the vessels closely, you can see both the ACAs, two parallel lines, they are okay. You can see the M1, you can see the A1 and ICA on both sides. You can see the flow void. You can see the basilar artery. You can see, and then you can see the carotids at the skull base. So far, so good. Am I correct?
Yeah.
Okay, you can see the basilar, then leftward. Where is the signal in
The
the
right.
rightward?
Yeah.
So there is no signal in the right vertebral artery. You can
Yes.
see parallel lines, but you don't see
Plus flow void.
any flow void. The other thing important I want you to learn here is that the you can see the always look at the gradient echo. Sometimes you do see a black line of a thrombus on the gradient echo, not on this. Here in this case, all other vessels are looking as black except this, the vertebral artery. But when you look at the diffusion weighted imaging, which was here, sorry, the flare imaging, look at this, the flare. There is a
Yes.
signal change in the tonsil,
Mm-hmm.
correct?
Yes.
And if you look at the diffusion, here you go. You have got a medullary infarct. This is the anterior right half medullary infarct. That is a classical with the vertebral artery. Okay,
Yes.
so you see absence of signal in even on the normal study of the brain with such a strong history that we gave you. There is a vertebral artery signal loss, there is diffusion restriction, and that goes in with the vertebral artery perforator infarct involving the medulla. It's a classical picture.
Mhm.
Okay. So
Okay.
what will you do now here? The next question before the examiner asks you, what are you going to do further? What will
Um,
you do?
I would do a CT angiogram to rule out vertebral artery dissection.
Yeah. So there
And
are two things that you will do. One, you will do a CT angiogram to rule out. One was the vertebral artery dissection, and the second,
steel cell.
embolic. Embolic.
Oh, okay. Embolic.
Third,
Uh,
atherosclerotic. You can have vertebral origin stenosis leading to vertebral occlusion. So three things you want to rule out.
okay.
Atherosclerotic stenosis leading to occlusion, embolic coming from the heart, getting thrombus lodged and occluding the vessel, and the third is a dissection.
Mhm.
Correct?
Okay.
Perfect. And also, you will go to, because this is an acute infarct, you would straight away talk to the stroke team. because you can't let this patient go home. You have to inform the stroke team, because these days, once they rule out the hemorrhage, they immediately put these patients on dual antiplatelets.
Okay.
Correct?
Yes.
Okay, so that's what something you need to know about. Good, excellent. So to sum up for the audience, right vertebral artery loss of signal void, diffusion restriction, and the flare signal change, subtle signal change of the of this area that we see. This you can see here, the signal change. So this is telling you that you got a problem here. Okay. And what are you going to do? CT angiogram and stroke team review. Okay, so we move on to the next case. Okay.